Bismillahirrahmanirrahim. Thank you for giving me this opportunity to the organizers. I feel honored to be here to discuss this topic today. I feel I've had the absolute privilege and joy of running a general dental practice in the state of California for more than 25 years. Something about me, I graduated in dental school in India in '91 and got my California state license through the foreign trained dentist exam. And I worked initially for some offices, and then halfway through I started my own practice. So why start your own practice? It is a lot of work and responsibility, but obviously Mola ni khushi hai. Always Mola has said, be business minded, and so we control all the clinical decisions. I was talking about a new movement dentist who recently told me, I was his mentor, told him to go to dental school. He said he was not satisfied because the managing dentist was forcing him to cut crowns on teeth that in the previous location he didn't have to. But he left that location because he was not happy with the volume, he was exhausted, and this new place, he feels like these are unnecessary teeth he's cutting. And that was one of the questions. I was talking to somebody, a movement dentist going to dental school versus somebody else. But yes, being your own boss gives you the ability to do anything you want. You can take as much time off as you want. We all are attending Ashara. We're now doing Kun Safar bin Mola, Istifada. I block my schedule early to go for Misak Majlis, if it's early in the day, anything. All of us can take off as much time as we want. So there are obviously perks to starting the dental practice. I just broke down my presentation in 3 phases. Did I already go? I think I'm going in the wrong direction. Okay. So every practice, every business venture, I believe, needs a purpose. You need a purpose and you need a vision. In 2021 Ashara, Aka Mulai Talab to ni series ma a kalam ki data, and I have always been inspired by this kalam. I feel purpose keeps you grounded. When you have that negative review which is posted for your practice, when you have that emergency, maybe a compressor breaks down, having a purpose why you're doing this keeps you grounded. And Maulana Alina Kalam, I sought leadership and found it in seeking knowledge and in humility. I feel improving my skills with CE courses, attending Istifada, local sabak has allowed me to lead my team. I personally feel when I go to Ashara and Istifada Ilmiya, I get my personal calibration done. And I've also always believed in what Mahatma Gandhi has said, that a life lived in the service of others is the best life. And our Aka Mola, Tabul Umrav Sharif, is the best embodiment of that. Din Raat Mola apna hakma dua kare she, ane various sansthana through muminin nu upliftment kare she. Our SBMA and Mahalush Shifa initiative are prime examples of that. So I just broke down my general dental practice timeline in 3 different years. The early years when I was established, and now that I'm a mature practice. So in my basically when you start a practice, you could go about doing it 2 ways. You could buy a practice like Mufaddal Bhai did. You do need an upfront Qarzan Hasana payment if you don't have the finances. For some new dentists, it might be tough if they're dealing with school loans and may not be feasible. So the other option open to me about more than 25 years ago was to start a scratch practice. Scratch practice is tough. So what I did was I started renting space from a couple dentists in my area. And when I had developed enough patient base, I built out an existing office space. And I kept my regular schedule And what I did was I started seeing patients in the evening and on weekends. And in a year and a half, I had enough patient base. I was busy, and I built this practice to my specifications. Ergonomically, what I had seen in the other place worked, and I started my practice in about 2000. And what we did to attract the new patients, we invested heavily in online marketing. I did 877 luminaires 25 years ago. I did teeth whitening Google ads. I just want to get the patient in the door. There was a Jay Geyer Scheduling Institute. He calls it Scheduling Institute now, but I sent my front desk team to learn, train them for phone skills. And my husband, Kaid, he figured out that most new patient phone calls came during the lunch hour. So he made sure that we answered our phones all the time. We also got another expensive service called UPC, which had 24/7 live, very skilled people taking the phone calls and answering as if they were my own front desk. And the ROI was worth it because they got us appointments, weekends, late evenings, and that also helped me in the initial years. And then we were open every Saturday. This allowed me to see kids without missing school. And in our area, a lot of people carpooled because they took the BART, the rapid transit in the Bay Area, so they were not able to make it on the weekdays. So my formula was to be open on Saturdays and see these people. And madrasa was on Saturdays, so my kids did not need me. It was the day with their dad. They went to madrasa and they did all their karate, swimming, everything. So I was not missed. And so it gave me time to grow the practice without being missed on the home front. And then I started taking extensive CE courses. So since I came from India, I had a little bit of disadvantage. And so the first 10 years, I did a lot of CE courses. I told somebody earlier that my success in running this practice is actually attributed to my husband, Kaid. He's very busy himself. He has a chemical engineering profession. But it was his marketing skills, his IT skills, his financial advice. Without that, I could not have grown my practice. And then obviously, I had family members at various stages of my personal life. My mother-in-law, my mom, my dad, they came and they stayed in the first couple years when my kids were very young, so I didn't have to do home daycare. And then once when my kids were older, my mom-in-law had moved in with us. So she was there for the unconditional love. It allowed me to stay late at work. It allowed me to travel and help me get the education that I needed. These are some of the things I did very early on. I started with dogs. I got Invisalign trained. I got a pediatric oral sedation license at UCLA, and I still like to use that. I did cosmetic dentistry training. I did Spears. I got the CIREC in 2008. I did Loma Linda implants maxi course. I did an endo continuum at USC. I did sleep disorders in dentistry. I did IV sedation at USC. I learned how to do wisdom teeth extraction, so I could do the IV sedation and wisdom teeth. I was also doing sinus lifts at that time with my maxi course. Then I got the fellowship in ICOI, associate fellowship in AAID. I had got the FAGD by then. I started lasers very early on. I have many diode lasers in my office, and I got the Photona twin laser about 3-4 years back. And all of this culminated in my MAGD in 2018-2019 timeframe. And I believe the MAGD has been very important in growing me as a dentist. A lot of my colleagues from that time frame are still part of my group that I call upon in a daily dental query, because we all spend 4 years meeting every month in Newport Beach on the master track, and every month we had to do a presentation. And we all were general dentists, and we all grew and learned from each other. So this is my practice in 2005. This is what it looked like. I had Akamullah Sayyidina Muhammad Burhanuddin visit Fremont to do Masjid Iftitah. And I was very fortunate. Maulai Karam and Hasan Farmavi ne ziyafat kabul ki di. I only had 2 chairs at that time. and the office had room that I could do Shehzad Sabni. This is one of the ops when no chairs were installed. I have an X-ray pass-through over there. I'm actually over there. And आज ज़ियाफ़त में हमारे husband ने हदीयत भी थी. And मोला जे रूम में नमाज पढ़ी है. Initially I had like a family room. પછી ઘણા વુમેન મને કહી કે મને આ રૂમમાં ટ્રીટમેન્ટ કરવી છે. Eventually I put a dental chair in that room. અને મારો એક બી ફોટો નથી because છેક હટો પછી જેવા મોલા તશરીફ લાયા તો કોઈ જનાબ કઈ બૈરોનો ફોટો ના લાવ હાથ ઉપર કરો. So I have a back photo of Burhan Mola, but this is I've cherished this memory again and again. And Maulana Kadamni Barakat in 2015 during the California Masajid Safar, Mufaddal Mola Karamane Ehsan Farmavine Kadam Mubarakida. The whole movie plays in front of my eyes. By this time, because of Burhan Maulana Kadam Mubaraksi had gone into across the hallway, I had acquired another suite. And Mufaddal Maulana puchu ke Babaji Saab ka Kadam kidata. And pachi he walked it everywhere where Burhan Mola had done Kadam. Pachi me kidu Mola na wo extension che. And everybody was on one side of my suite, we have a hallway, and he and I walked all alone in across the hall. There was nobody with us. Shehzad Saab hata, actually I didn't put that picture, but right behind is Shah Hussain Bhai Saab. And what he did was, we had a Keurig coffee maker at that time, pre-COVID. He actually made a cup of coffee, which none of us knew. And there's a picture where he's trying to blow on it to cool it down. And when Kamala Tashreef lai gaya, actually 45 minutes in visit hati, which I didn't realize it was so long. Apparently Maulana lab laga bhi lidela, ne mar husband ne kidu aar tamara vaste che. So I have a picture where Shah Hussain Bhai Saab is blowing on the Keurig to cool it down. So again, this whole visit is so cherished, and I feel that Maulana Kadamni Barakat has also given me the energy to keep going. And I Burhan Mola ne aras ki deli in 2005 ke mane hajin dentistry ma agal padano shok che. So Burhan Mola, I remember his gesture, kari ma tashrif lai gayela, and he said, "Have doctor to cho." You know, he was wondering why am I wanting to do advanced education. But I think that I always felt that if I came from India, I wanted to be on the par with what a US general dentist learned in their 4 years. So these are some of my cherished memories. So, did I go in the right way? So now, this was my growth. It took me about 10 years. I got established, and as I was sharing with somebody, what do I do now? I have this practice, it's running, I have associates, I have a hygienist, I have a big staff, what should I do? So I got the opportunity to expand my office, and also I got an opportunity to create another location. And what I did was, I had 5 chairs in my original suite, and when I moved across the hall, I got a larger break room with washer, dryer, lockers. I got a dedicated accounting office. I got a server room. I got a family room where, since I'm a family dentist, I have strollers in there. Kids stay in there. I have a station for the IT if the parents want to work. And my CT scan was housed there. And I got another opportunity to extend again because the second tenant moved out. So at this time, I didn't need any admin room. So we put 3 additional dental suites in there. It just so happened that my practice style, I realized I cannot do dentistry on both sides, though they are perfectly capable of doing dentistry. So now I have hygienists who work there. So on Saturdays, because I have 25 years of patience, every Saturday, I have 3 hygienists who work on the other side. And on my 5 chairs, we see a lot of pedo. I've developed a practice style where I only do dentistry Monday to Friday. Saturday, we don't do any restorative. And the reason is it allows me to be out of the office. The hygienists, the hygiene checks have to be done with skill. I teach my associates how to do it because hygiene gives you the revenue to come in the dental chair. So that's my setup at this time. And then I decided that maybe I should open an office because my patients were insisting on it. Large patient base had moved to a neighboring district or neighboring high school district because they were bigger, better. The Jamaat school district, high schools were not that good, and a lot of my Indian patient base was moving. So they kept telling me, why don't you move towards us? And I thought, okay, let's do that. So I got a broker. This is my office expansion. I had just moved across the hallway. So I got a broker, and in 2015, This is Eric Swalwell. I don't know if any of you know him. 10 years ago, he was not that big in the US politics, but now he's, for the Democrats, he's pretty big. And there was a congresswoman as well. So they both came for the ribbon cutting. And that's my Dublin office, which opened in 2015. And I have all the chairs, they come right side of the wall, because I had found that was very good for my body posture. Let's go back. Yeah, that's another view of my office. So one of the challenges I faced was hiring additional dentists. Let me see if I have it track. Hygiene checks took a lot of my time, and I didn't have any time to do any restorative work. And I was having 8 hygiene checks, 16 hygiene checks, just not possible. So I had to hire associates. I got associates actually very early on, and it just happened by accident. A patient said, my relative just graduated, can you please hire her? And I said, okay, and that started. I hired her, and she moved out, but then I've always had associates since the early days. Also, when it freed me up, I was able to do some skilled procedures myself. Early on, I used to have an oral surgeon come to my office, do all my third molar extractions. I had a periodontist come into my office, and also an endodontist come in my office. But over a period of time, what I realized was, because I was doing so many of the procedures myself, to maintain their schedule was exhausting. My office manager would say, do you want to do this, or you want to wait for 1 month for him? And then there was sometimes if the molar endo, I just took them out of pain, when he was coming, they would say, oh no, I have a business meeting, I don't want to come in today. His schedule would open up, and we have to call him and tell him, well, you had 4 or 5 patients, now you're down to 3. He says, no, I'm not coming, or give me half day. So those were some of the hiccups we had. So over a 2-year period, I phased out pretty much all the specialists because of the way I was practicing dentistry. And then my associates, I've had, at this present time, I have about 4 to 5 associates between my 2 offices. And I found that I was very lucky initially. Maybe I find it's a generation gap. 25 plus years ago, when I started hiring, the mentality of my associates was different. So the first associate was with me for 10 years. Very skilled. She had done 1 year of pros as well. And she just reflected my belief. And this was what helped me to grow my practice. And I always do shukr for that, because after she left, she had a shoulder injury. And after she left, I found the associates who was hiring. 10 years also makes a little bit of a difference. Their attitude, their skill set was not on par with her. So over the years, all these years, what I do is I have videotaped all my procedures. I show them exactly how I do my class 2s, how I do my class 5s. I want no flash, I want no overhang. In the first few days, my assistants will take bite wings, they dry the teeth, they take intraoral camera pictures. I want to look at the embrasures. I sit down and I talk to them. I spend a lot of time, because I'm a very hands-on dentist, because sometimes if they leave, I'm going to redo that work, because these patients keep coming back to me year after year. So working with associates is sometimes exhausting if they don't have the same mindset as you. If they're just doing this to just work here 2 days, work there 2 days. My best associate is somebody who works with me 5 days a week or 4 days a week and don't go anywhere else. Because I find if they go to another office, that office culture is different than mine. And their habits over there, they sometimes tell me that we've never seen an owner dentist that invested, because my owner dentist is sitting in their room, they don't care what I do. And I tell them, well, that's not how I want to run my practice. So sometimes the associates who have not shown that caliber of work, I've had to have the hard talk and say, well, it's not going to work out. And then sometimes I've hired associates who the patients absolutely love. They're so personable, they are so good, everybody wants to see them, and sometimes the skill set just doesn't improve. And those associates also we've had to weed out. So as we all know in life, it's, and I always am happy that I've had the opportunities to work with good people. Right now, I have a great associate. She's been with me for 8 years. She's had 3 kids in this 8 years with me. Every time she goes, she's the solid associate. Then I have other ones she supervises with me. So it's, it's a work in progress like everybody else. And the hygienist, very, very crucial. Everywhere, hygiene hygienists are in short supply. So we've had to work with that as well, how to get the hygienists motivated, keep coming, and not say, oh, I'm decided to take a day off or shorten my work week. A hygiene coordinator, very important. I need to train them, fill the gaps, otherwise a good schedule can really break the day. So some of the clinical challenges that I have faced with doing all this in-house work is implementing it. Initially, when I was implementing one technology at a time, it was easy. Now I have so many things I do that sometimes it's also exhausting for the staff members, especially if one of my lead RDA, she's been with me for 20 years. She's had 3 kids over 20 years. And every time she goes, some of the things that she does, like the piezotome, how to maintain it for sinus lifts, is a hardship for me. So staff changeover, staff vacation has been a big deal for us. And also the technology. I mean, I've updated my entire computer system so many times. My CPUs are this small now, just like all of you. And constant, having the IT technician on board to help us out. The front desk also, with all the new things that we do, they're constantly online. They need to check emails, they need to check text messages, all the specialist communication, the inventory for everything. I mill zirconia, I mill Emax, I mill block, which is 80% composite and 20% resin, just the shade inventory. All the different bones I use, the Emdogain in the fridge, the bleaching gel for teeth whitening. It's I place 2 different brands of implants, and now only one. My specialist was placing Astra and Strawman, and 6 months ago he told me he wants to go to Neodent. So she was so good having all the drivers separated. Now she and I have to relearn all the Neodent stuff. So 2 people take care of all my implant drivers and everything, all the scan bodies, and make sure all the labs. So it's a lot of work when you try to do all of this, plus the regulations for amalgam wastewater, the traps, the amalgam separator, the logs, the OSHA training, all the maintenance. It does take a lot from the staff, and Mufaddal is doing Invisalign. So Invisalign, I've been on-off Invisalign provider because my mindset was I want to really finish the case well. And somewhere they told me, don't have that mindset, it doesn't work. You need to finish and do some cosmetic recontouring, do some cosmetic bonding. And even if I got the case finished well, they were not wearing the retainers. So the Invisaligns also suck up a lot of time. You have to do those reviews. Right now, my ClinCheck reviews are done by an orthodontist. I pay him $150 for every ClinCheck review. I just don't have the bandwidth, and I don't have the skill that he has. We have virtual care now for Invisalign, but still, you can't just close your eyes and let the patient finish. So all of these are clinical challenges I face in trying to be what some of my friends call that we are super GPs. We want to do everything in-house, and it can be exhausting. So it's a choice I have done right now because I enjoy doing it. And I know anybody who doesn't want to do it, I totally understand. If they want to just do certain procedures. I recently heard David Galler. I was doing Reengage 1, Reengage 2. I did them in succession, a year apart. And he laughs and he says, there was a time when he used to fear litigation. And he's saying, we don't fear litigation anymore, we fear the reviews. Because for a GP practice, if you're dependent on your online marketing, the reviews can really make your practice, or it can turn patients away. My staff works really hard. We roll out the red carpet, so to speak. Very personable people. We have sometimes reviews saying that the voice on the phone was so welcoming that I didn't want to shop around and go someplace else. And they constantly tell me how they love working with them, how the ladies work around their schedule. I know sometimes I've told my office manager, if somebody wants to come at this time, check the next person's schedule. If they're flexible, move them around. Move them half an hour. Let this person come, when they can pick up the kid, drop them home and come. So all of this, they have to maintain small little tags. If they move the patient once, they have to write down, don't move them again, because we've had that review too. Every time you move me too often. So it's a challenge to run this and keep in mind that the patients don't feel like, they are a number. They want to feel like this is a place where they value me. Employee interpersonal conflicts is always an issue, managing the team. Sometimes when they get too friendly, we had a couple years ago, they got too friendly, and outside the office, their friendship broke up. And when they were coming to the office, they were just not performing. So we kept the one who was the best, and we had to have a talk and let them go in a way that there would not be an issue with how we let them go. So that's also learning how to let an employee go. I have a friend from my MT4. He told me that his hygienist of 18 years is suing him right now because she was becoming a prima donna. That's what he tells us. And she was just not working out. So he had to let her go, and now she's suing him. So again, all this employee-related issues are always going to be an issue. I face that. All of you face it all the time. I have to be a leader, but I still have to do the artistic work. I still need to worry about the daily goals, be the psychologist. Sometimes a patient is actually afraid and doesn't want to do the work. Sometimes they don't want to pay. Sometimes they just don't want to get numb. Okay, what is it? Why are they refusing? So I have to sit down and figure out why is this patient not wanting to do. And then yes, compliance. We have to make sure, because sometimes if the staff ever leaves, I've seen, they came and told me, oh, my previous dentist was not doing this. So we have to make sure every day, we make sure we are compliant with all the laws.
On your third point there, I had somebody tell me a line that I still live by. Imtiaz Manji, who's the
I know him.
Yeah. Imtiaz goes to me, he goes, you are CEO that happens to be a periodontist. So what is the job of CEO? Put the right people in the right places. Their job is not to do everything. So like you're listing like a bunch of stuff, right? You're the accountant, your counselor, your compliance officers. If you switch in the head, right?
Yes.
If you delegate those things out to people who can do it, because the CEO of a company doesn't do everything.
Correct. You're right.
But you are a CEO,
Yes.
you run a massive enterprise.
Yes.
Not enough hours in the day.
You're right. So I have a slide to that delegate. So it's the systems in place eventually. But the buck stops with us. If an associate decided that they want to go home early, and instead of doing the crown prep, they're just going to go on the quadrant and just do a filling so they can leave early for the day, that's the hard decision, right? The office manager can come and tell you that this was an endo treated tooth, they were supposed to crown today, but they want to leave half an hour early. So they said, I'm just going to do this filling. So yes, I do get you, and my office is a work in progress, and I try to delegate so much. So yes, what do? This is just something from online. You're exhausted. I have had friends who tell me that they sold their practice and they are working for other people now because you just couldn't hack it. We all can, they can go seek help in other places. For us, I feel, if you are in the Jamaat, the namaz, the dua, Nazul Maqam, just attending masjid regularly. It's so nice to go there and, Mola ni dua che and Mola hamesh dua kare che. So I feel for us, the stress can be relieved by getting this break, volunteering, just going to the masjid and doing a khidmat. So how have I reduced my stress? I think Huzaifa Bhai was asking me about burnout. So because I did so much of CE training, I figured out what I like and what I don't like. And what I also did was, what I didn't like, I figured out why don't I like it. So when my kids were young, I saw all their friends. And I actually liked working with kids, which was very rare, because when I did my master track, none of my friends wanted to see kids. All of that preconceived attitude. And I did not do any oral conscious sedation like I learned. I would not do midazolam because it was a hit or miss. I just started doing nitrous. And I found that I had that window, and I had some great nursery rhymes. And the parents were so appreciative, because I would send them to pedo, and they would say, okay, $1,500 for general anesthesia, and we'll get all this done. And they would come back and say, well, my husband doesn't want to pay $1,500 because my insurance doesn't. plus I'm going to run out because everything was to be done in this window. So there were some patients where, you know, they forced me to, okay, improve my skills. So I like pedo. I do a lot of pedo. I do nitrous. I apply SDF for the 2-year-olds. I do a lot of GI, RMGI, and I've trained my associates too. Some of my associates don't like pedo, and that's another challenge. They will get the patient in, then say, schedule Dr. Munira, and that's something I really, nothing I can do. I also figured out, somebody asked me about all on 4, Shabir asked me. I started doing all on 4 after my maxi course and my sinus lifts. I have some all on 4 cases I did. I had mentors, they would help me plan. And over a period of years, I realized, I was married to these patients. And the planning for me as a GP doing all this was taking up too much of my time. Sitting and planning, working those times 10 years ago, getting this great surgical guide and blocking my half day to place these implants, getting the conversion, and then getting the final prosthesis, and then following up. I found out over a 2-3 year period, I didn't enjoy. It was not a money maker for me. And also the stress, so I stopped doing all on 4. I love doing single implants. I do the 2 implant overdenture, any prosthesis. I also love resin. I like cosmetic bonding a lot. So I do all the things that I like. And sedation is a big thing in my practice. I see a lot of phobic patients, but it's all oral conscious sedation. And I use my diode laser a lot. I have many all over the office. I have those pen ones. And then I got the Photona just because of, they were trying to get me to use the MVP periolase. I attended 2 study clubs. I was really impressed with the NDAG. And I was on the fringe of buying the MVP, 75,000, many, many years ago. And then somehow the Photona rep or somebody came by, or the Solea rep came by, and they were telling me, why just, you're a general dentist, why just have one laser, get the twin wavelength. And then so I realized maybe, yes, I have a market. So I got the Photona laser, and I've been happy with it. I can't bill the patient a lot. We charge a laser fee. So I like doing some of the things, that I feel I excel at. And you all have to identify what kind of style you want. Like Mufaddal said, he likes to do certain things. And when I did the Spears continuum, I did the occlusion, the facially generated treatment planning. I invested in that $5,000 articulator, and I realized that I really don't want that kind of practice, because where I work, all the Jamaat population was coming to me. I had to do pedo, I had to do perio. If I limited myself to full mouth rehabs, these people were dependent on me. And I was telling somebody, we don't have any physicians in Fremont, no medical doctors. One who grew up moved to Houston, and they would come to me for small trivial help, because I was there in a masjid. I remember once a lady came because any ring fasai gaili, nakhi angli suji gaili. And doctor told her, go to ER. And then somebody told her, Munira bin passe jao. And obviously it took me 10 seconds to cut her ring. Like she didn't, husband told him, gari bhi park noti kari. And then I make it okay, yes. And I just sat her down, and in 2 seconds it was a gold ring, diamond drill bit, cut it off, and the poor lady. So I realized I like seeing the Jamaat people. I like to help them. And I was 5 minutes from a masjid. So I realized I cannot have that boutique style practice where I only do full mouth. So I had to be, a GP. So I wanted to just do everything that I can with the best skills that they deserve. So anyways, that's what I did. I weeded out things. And am I fee for service? So I have never been in network with any insurance ever. First I started, my husband and I decided we didn't want to. And I'm only Delta Premier in Fremont. I'm not even Delta Premier in my Dublin location. And so the fee structure, we help them because I'm insurance driven. A patient comes in, do you take Delta? Facebook, big employer, Google, big employer, all those, do you take this insurance? So yes, we do. We bill for them and we do everything for them. Just want to be in the same line. So this is what you were asking me about earlier. How do I avoid being a CEO? I do. Systems in place. I'm actually currently working with somebody. But I find that some of my systems, because of the way I think, what would work for dentist A may not work for me, because I want to do some things on that day. I want to be practical. Scheduling with my hygienist, sometimes for something which is causing them, and her schedule may not be open, doesn't make common sense for me. So sometimes I will tell my assistant, go set up the room. I'm going to do it today. So I sometimes can make my schedule busy. I do delegate admin tasks as much as I can. You know, let me find the right slide here, because so I've also found that I've been attending Ashara. I've seen Josefa and everybody. Since Houston, I started volunteering proactively at the Ashara dental camps, and I really like it. I've been meeting dentists, and Mola, every time dentist na hakma dua kare she. And I've made a lot of friends. I know, probably know Fatima Ben Bapai. This is the latest picture I had with her in Chennai. And I think I've met Josefa Bai Talib. I've met so many international dentists, and it's just interesting talking to them. Recently, I had a patient who had flown in from out of state, Muminata. She had come to me for implants, actually. And then she flew in 3 months later for me to place the crowns. And unknowingly, she didn't tell me that when I told her, tomorrow crown delivery aaje tha se, she booked a ticket to fly out next morning at 7:30. And then I didn't know, so I usually had to deliver 2 crowns, and I had a single crown as well. And she was numb, and I think she was in a rush. She called me up and said, "Oh, bite haiche." I only knew that I bite. And flying to California was not feasible. Luckily, I met her in Istifada Ilmiya. I went, walked around in Surat, and I asked 2 dentists, ek to Muslim ata. I said, I said, "Can I bring my patient in?" He was so welcoming, Muslim ato. Hedari Kasamjin Methangna Pachal. He said, "Awo ben, kare bhi awo." And I went to Mumin dentist. So Mumin dentist ben na staff was saying, "Hamare naam apo, tamare phone karsu, ben se puchsu." In a Mumin dentist phone ayoj ne mane. When I took this patient with me, I walked in this Muslim dentist's office. So welcoming. He opened brand new packs for me. I had my loops, and the assistant Amina mane help kiri. I adjusted this lady's bite, and I think I was the most happiest that day, because I felt, you know, how people trap line and you do something so silly. But anyways, so going to Ashara has always helped me. One other thing I found, talked about right side chair delivery. The ergonomics, I feel, for the long haul is the most important thing. My consultants told me, the people who are plumbing my office, that you can make it cheaper, just put rear delivery. You need to bring water only on one location. But I was used to having side delivery in my other office where I was renting space. They told me, look, I told my husband too, you know, the project is going up. Why do you guys want to spend money? I said, no, I like right delivery. It's good for my shoulder, for my back. I want to do it. So these are obviously over the patient. So I have all my rooms plumbed, all my, my 5 chairs in my Dublin location, my 5 chairs in Fremont, right-handed delivery coming from the wall. And then when I got 3 chairs for my hygiene extension, I got them over the patient like this. All my chairs are ADEC. 25 years ago, I think the dealer wanted to get good commission, and I haven't regretted. ADEC is really excellent. So I have all my chairs, you know, we have coming from the right. I cannot hire a left-handed dentist. I have only had one apply to me, and she was a woman, and then she opened her own practice half an hour away from us. We have 5 dentists in Fremont and no physicians. Ergo loops, I think they're great. I used Galilean loops for the longest time. I have so many, but I went to Ergo loops last year, and I have been, you know, I've found they're amazing. I started with one, now I've got the variable loops. I can go up to 10x on my Ergo loops. So I got Endow, Edmatec. So I find it, you know, the loops make the big difference in your posture. You're sitting so many hours. And you know, the advantage of working on Saturdays for me was I took a weekday off. So I worked 3 days, and the 4th day, Thursdays, I totally don't do any dentistry at all. And it allows me to just catch up on anything, and it gives me a break from that posture. And I've done that for a while. How do we keep it exciting? So we have the Lumina scanner because I am doing iTero. It is so amazing when they can see it. They see it, we do the ortho simulation. Sometimes if money is not a constraint or they have been thinking about ortho, they agree. If we are just educating them, they probably won't do ortho on that day, but maybe 6 months later, 1 year later, they put money in FSA, they get dual insurance, and that's how we help them. We tell them, does the spouse work? Maybe you could get dual insurance and minimize the out-of-pocket. So I find that when they see it, they believe it. I have a very high resolution intraoral camera from Kodak, Carestream. It's amazing. I've used it many, many years. Very expensive, but I feel the ROI is worth it. My intraoral scanners, I have 3. I got a cone beam long time ago. And it's interesting, right now my cone beam works perfectly fine, but the software is not being supported. And then I do same day dentistry. That's what I was saying. My assistants are used to me. I will bring a patient from hygiene into it. If they have a class 5, they're sensitive, that's how I mess up the order. I don't want them to drive just for a class 5. They have a buccal pit, I'll say, okay, come on, let's just take care of it today. And obviously it adds to your bottom line for that day. So I do bring patients over. And I found that in my 25 years, I have refurbished my office 3 times. And it is really helpful for the patients to, that's how it looked initially. I had an in-between repaint. This is currently, we just keep up with the style, long, 25 years ago, colors were in vogue. My interior designer said, now it's all this palette, and obviously we changed the flooring. Patients always feel the cleanliness when they come, so I find that that has also helped us. Lastly, I think what we've done, we've automated almost everything, and I again have my husband to thank for this. He outsourced my insurance verification a decade ago. He had something called Dental Robot, which was just coming out. Then we got Verific, and now we have AOB. All the insurance is verified. The girls just have to look at it. I have an off-site employee in the Philippines who does all the work that the girls cannot. She knows what to do. Virtual receptionist, I was used to it, but somewhere on the line I had dropped the UPC. They were very expensive because it was established. So right now we have voice AI. My older son works for a company called Arini, which was a startup, and the MB2 DSO, which has 800 offices, just signed up with them. So I'm actually head Arini, but right now I have on and off. My son actually uses us as beta testing for his company. And I still have ongoing marketing, all the things that you guys do. And your best patients, your ambassadors are your own patients. As a mature practice, what have I faced? My equipment gets older. So much maintenance, those syringe buttons, those lines. Billing, sorry? Billing? No, we don't know. So I actually, my IT guy, very bright, went to MIT, but got burnt out, started to doing dental IT, such a brilliant guy. So he started a company, he's very rich, called Zentist. They were so he told me, do you want to outsource your billing to me? And he had beta testing in some of the companies. And then he told me, Doctor, wait, I'll tell you, because I've known him for so long. So he came and told me, there are some glitches, and he told me, just keep your billing in-house. And right now, he actually left that company, and he started on something else. But he told me what the challenges were in having, the claims sent out, outsourced claims, the billing. So no, I have a dedicated person who just does my claims, and I have she has her own room, and she is also very trusted. She's been with me for 25 years. She handles all my money. So that's why I sometimes was shukur that these employees have stuck with me. I don't have to worry about if she's handling everything. And that's one of the reasons I think I've not outsourced it, because she's been valuable to me. I think I missed a slide. Yeah, so I face this. Every time I call somebody to come and fix my stuff, flat fee, $320 just to show up in the office in my area. Patterson, Henry Schein. I tell the girls, you can't just call them for one air water syringe button, which doesn't work. So it is an issue, equipment gets older. You have to maintain it. Also, when I hire somebody new, it's a big hardship. They've never seen all these things that we do. We're expecting them to know really well how to change the nitrous tanks, so on and so on and forth. We want them to mill my crowns. We want them to design it. We don't want to learn how to, I don't use a glazing oven so much. They're just, even when they're mature, they're just like, they get that shock. You know, we never did any of that. My payroll is very high because I have so many senior employees. The medical premiums are very high. I offer medical insurance, I offer 401k. That's how I think in my area I've been able to attract some people and have them stay. And I think as I was talking to somebody or a few, I have to plan my exit strategy. I don't have a family member to take over. If I had to ask my child, yes, go into dentistry. Both of my boys chose not to do dentistry. So I have to figure out what will my exit strategy. Mola Tashif Layache, I'm going to hang on to the office for a very long time. We'll see. That's, again, we'll figure it out. Some of the pearls, I think I've worked with my assistants. We always help them make their specials referrals because they don't want to call. They have this inertia. Oh, I don't want to call. So we make them. And I find bread and butter dentistry is very profitable. Sometimes if I plan to do maybe a bone graft membrane, surgical extraction. By the way, one of the practice pearls, everybody should learn atraumatic extractions, immediate implants if you are interested. Sometimes a bone graft membrane can be a little lucrative, even for my associates. What I say, bread and butter dentistry can also be very profitable. Doing class 5s, doing those incipient carious lesions on a teenager, we may not look, but can give you the same revenue and maybe in less amount of time. And sometimes if the associate hasn't cleaned out the extraction socket well, they were lazy or they were just afraid, they have not done a great job. So I find that any day if they want to do just simple dentistry, I'm okay with it. It's taken a while for me to get the team. I had a great team. I actually sent them for retreats. I had this 5 core people. I sent them to Vegas one year, I sent them to Hawaii, I sent them to Disney, and that team broke up. Somebody got pregnant, somebody's personal situation changed. It took me a long time to get a team again together, and there were ups and downs. My husband is my constant, I share with him. Alhamdulillah, I'm starting to get a team again together. And yes, patients can feel, sometimes they just come back to us, as I said, because they feel like the staff treats them well. We hear that all the time. So I tell my staff, just treat them well. And I tell them, think about what if your mother-in-law went to an eye doctor and they were ignored. Or she wanted to try a pair of glasses and they thought this person was very hasty and they would be afraid if they kept trying, how would they feel? So I tell them project that and treat the patients well. And right now I currently between the 2 offices, I have between 22 to 25 employees. I have 1 male associate, most of them are ladies. And the team keeps changing. Some of my associates over the period of years, we always have a Christmas lunch together. And sometimes some people make it. Some people, if they're working on that day someplace else, they don't make it. So in conclusion, I hear all the time that work less, work smart. If you guys can make it happen, great. I feel a work-life balance. Rasulullah kidu che ke safar karo. Safar is gaining knowledge. And I feel that you should travel, go on your journey, take CE courses, attend the masjid events as you like. And I also do shukr every day that we have the ability to earn our livelihood in our own hometown. Be our own bosses, raise our family, and help our patients and our Jamaat and our extended community. And I feel, that is enough for me. So, shukran lillah, alhamdulillah. Thank you all.
What is your strategy in terms of retaining associates?
Sorry?
Retaining
Associates. Very rarely. So, I've actually found associates 2 kinds. One, I know upfront what their mentality is. If they work for me, I can have them come over to my way of thinking. Because sometimes when they come from an office where they were put on a production, where if they didn't meet the daily goal or they had a daily percentage, they were used to doing the small lesions, and they would prep those crowns, which could be done. I love composite. I feel you can do great with it. And then I have learned to, for some of them, I tell them, I'll give you a healthy per diem. Don't worry about it. I don't want my patients treated just because you were trying to meet your daily goal. And that has been the most successful aspect. The reason I did that was my first associate, she told me that she was a 1-year pros. And she said that I actually want to do all the dentistry. If you're going to be in the office, you will not let me bridge prep. You will not let me place the implants. So, and she was going through a divorce. She said, I need a daily to take home. Just raise my daily per diem as you see my production increase, but don't give me a percentage. Because if you're sitting in the office, you will start the Invisalign case. I will not learn. So that was her talking to me, and I said, okay, we'll just give you a per diem. So it relieved me completely. She would, without even being involved, like she would see a limited exam. Initially, I was doing no charge implant consults just to get them in. She would see them, she would take the CT scan, she would map the nerve for me, she would draw the implant for me, and come and tell me in the other room, hey, I have an implant consult. Do you want to place the implant today? She would show me on the iPad. This is what it looks like. And I would say, yeah, go ahead. And she would numb for me, she would do consent form, and the assistants would give them pre-med, they would give them the, everything she would lay out for me. She never got anything for it, but she trained herself. And eventually, she did her own implants. I sent her. So that was one scenario where if the associate is not greedy or not motivated by a daily goal, that has helped me. I think some of the associates just feel that we want to help the patients, and they see that's different from where they came from. So some of them, if they're good, they will change their mindset. Some people, you cannot change them at all. No matter what they do, they only want to see their view. They will never be wrong. It is never their fault. It is always something. Those associates, I talk with my manager, let them go. But I think a lot, because if I let them go, the hassle of placing the ad, looking at those ads, phone interview, bringing them in, looking at them and saying, okay, does she sound like my patients would want to, hear from her or him? And then bringing them in for working interview. One day is not enough. So if they're working someplace else, we have to wait. And then they start. And now, I have to now supervise their work. I take the bite wings, I take the pictures, and I see how they do the case presentations. I show them how I do it. If all those checks are there, I release them. If not, right now we have an associate, sometimes I don't think he can multitask. So if he is doing something, he just will not remember that you're supposed to let the assistant know to call the next patient to come late or tell somebody to go numb his patient. Sometimes he backs up. But yeah, the associates is another lot of work, as I was talking with Huzafa Bhai.
Here's one general question to everyone. Where do you guys look for staff and for associates? Like what online platforms do you guys use? Just curious.
I've used Indeed a lot.